Minister, we're far from being out of the woods yet, and just yesterday the Department of Health confirmed 2,855 new cases of COVID-19, which is very worrying, 515 people in hospital and 91 of these in ICU. The last time an extension in these powers were proposed in May, there were 448 cases, 99 in hospital, with 41 in ICU, and we are far from being in the clear. This raise in cases is hugely concerning, and we need to do all we can to protect people's lives. While the use of the antigen testing is increasing, I do want to raise a concern I have that they are not catching some cases. Recently, I had a constituent contact me because their workplace was impacted when one staff member got COVID and the antigen test they took showed a negative result, while the PCR told a totally different story. If we are rolling out antigen testing, are there concerns being raised with you about them? And I also want to ask you about giving free antigen testing, because a lot of people have contacted me too to say that they find that they are expensive. So I'm just wondering, maybe would you come back to me in a written reply to that? The news last night of the extension of the booster vaccines to healthcare workers, and I really wanted to welcome that announcement, and I think it's really good because these vaccines will be administered this weekend. I want to ask you about the booster vaccine in the community. I had a lot of calls on the booster vaccine for the over 60s, but there is a little bit of confusion on the issue about the timeline, when will this be happening, and also, I suppose, Minister, about communication, because I know how hard you and your department are working, but I always just feel that we fall down in communication. So I would ask that communication be given out, whether it's true, whether you put it on papers, whether it goes on media, whether it's through the doctors, and I know how hard the doctors are working, but I would just ask you about communication. I still feel we're falling down there. I also feel it's so important that we take a minute to applaud the vaccinators. I mean, look, everybody has gone for nearly 2 years now. It has been extremely hard on people, and I think it is important that we do recognise the hard work that is being done. And I know it's really important that there's 90% of the population aged 12 and over are fully vaccinated. And I think, that's really important to say to the Irish people that the progress there really has been welcome. And I know that it is important. Look, vaccination, I believe, is going to be our protection, and our collective efforts have been protected as thousands of people who have been sick, but because now that they have had the vaccination, that they are actually, thank God, going to be on the mend. However, as of the 27th of October, a total of 5,436 COVID-19 related deaths has been reported in Ireland. There were 67 deaths notified in the week up to the 27th of October. And Minister, these are mothers, fathers, brothers, sisters, sons and daughters, and each life needs to be mourned, and every family has been affected in some way, and it's so hard. This means that through this coming winter, possibly in the face of high levels of infection, we will remain dependent upon public understanding and buy-in to the basic public health measures to minimise opportunities for this virus to transmit. We must ensure, again, Minister, communication is really important. To mind each other, wash your hands, social distance, wear your mask. All this, again, because of the rise, it's really concerning. And I've spoke to a lot of elderly people recently, and I know, again, there is concerns about going back out into the community. So I think, it's something we need to look at. But I want to ask you about ventilation, particularly in schools, because I know that schools in Carlow, they've exhausted a lot of recommendations to increase the ventilation, and still the CO2 monitors supplied by the schools, by the department, are recording inadequate levels of ventilation. And I'm just wondering, what is the update on this? I did address this to the Taoiseach the week previously, and I'm just wondering, what is the update on that? And I just want to ask you something, and I know I was affected by it, and I just want to know about hospital visits, and particularly for families maybe that have someone that's near end of life. And because I understand we have to be very mindful of our staff in the hospitals and patients in hospitals, but if you have someone that is coming to end of life, there has to be a compassionate grounds there on visiting. And it's not there because, as I said, I've gone through this myself. And I would ask you, Minister, that you would look at compassionate grounds, particularly for families that have someone in hospital that's near end of life. Because you know yourself, and I know from dealing with other people, myself and in my own area of Carlow, Kilkenny, that it has been so hard. But, you know, if you can't get in maybe to see a loved one in a hospital and you know that, you know, their time isn't long, it's very hard. And, you know, I just would ask you that you would actually really look at this and maybe come back to me on this too. Because, Minister, look, I know we need to support people. I know that businesses and individuals trying to support our recovery, that we have to look out for each other. We have to help each other and we have to protect ourselves and each other. And that's what it's all about. It's all about minding each other, protecting each other. And, you know, hopefully in the maybe early next year, or hopefully by then, that we will see changes, because, you know, it is very hard. I find myself from working in the community now and trying to get back to normality, as much as normality as we can. You know, people need that road, they need the roadmap, and we just need to make sure that we mind each other, look after each other. And again, I will be supporting this motion. Thank you very much.